Hey everyone, welcome back to another Explainer. Today we're diving into some pretty fascinating research out of the Journal of Oral Rehabilitation. For a lot of older adults, the actual physical mechanics of just swallowing can start to deteriorate. It literally turns every single meal into a high-stakes event. So we're going to unpack exactly why that happens, and then we'll look at this brilliant, completely new mechanical solution that's actually giving seniors their safety and dignity back. Okay, let's dive into this. Imagine for a second if something as automatic as swallowing suddenly took intense, conscious effort. And if you didn't do it perfectly, you could end up in the hospital. That is the terrifying reality for so many older adults right now. Because as we age, the intricate coordination of all those tiny muscles in our throat and neck kind of starts to weaken. And when that function starts failing, a simple sip of water or a bite of food can completely bypass the stomach and drop straight into the airway. It is an incredibly scary experience, and it builds this huge wall of anxiety around what should be one of life's greatest pleasures, eating. So in the medical world, this whole cluster of impairments is known as oral hypofunction. Basically, it's a pathological state where a bunch of different functions in your mouth and throat, stuff like chewing, tongue pressure, and swallowing, just become dangerously weak. Now, to understand why this happens, we really have to look at the suprahyoid muscles. Those are a group of muscles sitting right under your chin. I want you to think of them like a vital pulley system in your neck. Every time you swallow, this pulley system engages. It literally lifts your airway up and tucks it safely out of the way of falling food. But if those muscles get weak, well, the pulley fails and the airway just stays wide open. And look, the reason this matters goes way beyond just losing a little muscle mass in your neck. When that pulley system fails, we see some truly devastating downstream consequences. The biggest one, a massively elevated risk of aspiration pneumonia. That's what happens when food or liquid gets into the lungs and triggers a severe infection. And it's actually a leading cause of hospitalization and even mortality in older adults. And on top of that, the constant looming fear of choking makes people eat less. That drives malnutrition, physical frailty, and ultimately it just strips away a person's independence and completely tanks their overall quality of life. Section 1. Why traditional rehab fails. The limits of past methods. For a long time, the gold standard for strengthening these swallowing muscles has been something called the shaker exercise. But here's the problem. It requires a frail, maybe 80-year-old patient to lie totally flat on their back and basically do isolated neck crunches on the floor. I mean, unsurprisingly, the dropout rate is just notoriously high. Patients just get exhausted and stop doing it. So what we really need, the ideal alternative, is something that can be done in a comfortable seated position using manageable, adjustable resistance to safely rebuild that muscle without totally exhausting a vulnerable senior. Moving into Section 2, a novel neck collar, a mechanical solution. Now, what's really interesting about this is how beautifully simple the engineering is. Take a look at the wide chest support base at the bottom there in green. That just rests comfortably right against the user's chest. And then up top, you've got this padded chin support. Essentially, what the researchers did was design a miniaturized, highly specific weight machine for your neck. It's lightweight, it's non-invasive, and it hones in directly on those crucial swallowing muscles we were just talking about. The real secret sauce here, though, is the internal resistance coil spring located right at the pivot point. As the person does a gentle chin-tucking motion, they press down against that spring, and the spring pushes right back. This applies a targeted, therapeutic, mechanical load directly to those suprahyoid muscles right under the chin. So it's literally resistance training, pure and simple, just applied to a muscle group most of us probably never even think about. And check out the posture of the older participant using the device here. She's seated completely upright, just looking straight ahead. By using a spring to provide the resistance, the engineers completely solved the main issue with that old shaker exercise we mentioned. Gravity isn't the enemy anymore. The patient doesn't have to get down on the floor or strain their neck lying flat. They can literally just sit in their favorite chair, relax, and safely strengthen their throat muscles. All right, Section 3, the 6-week trial. Putting it to the test. To see if this actually works, the researchers set up a really rigorous randomized placebo-controlled trial. They found 30 community-dwelling older adults all over the age of 65 who already had a diagnosis of oral hypofunction. And crucially, through X-ray video testing, all 30 of them were confirmed to be actively aspirating, meaning food or liquid was already dangerously entering their airways. They split them perfectly down the middle, 15 into an experimental group using the real device, and 15 into a placebo group. And I love this detail. The placebo group got an identical-looking neck collar, but the researchers secretly removed the internal spring, so it offered zero actual resistance. So, for 6 weeks, both groups had to follow this strict daily exercise protocol. Step 1 was simple. Just sit upright with the device properly fitted. Step 2 was the dynamic portion. These are isotonic exercises, which meant 3 sets of 30 active chin tucks. Step 3 was the static, or isometric portion, where they had to hold that chin-tucked position firmly against the pad for 60 uninterrupted seconds. And they did that for 3 sets. And step 4? That was all about consistency. They hammered out this routine 5 days a week for 6 entire weeks. And this brilliantly illustrates exactly what that commitment looked like. I mean, this was a proper, intense workout regimen. 30 reps, a 5-minute rest, another 30, and so on, right into those 60-second holds. But here's the kicker. Because the participants were seated upright the whole time, they were actually able to complete the program without dropping out from physical exhaustion. Which brings us to Section 4, Stronger and Safer. Analyzing the results. Using surface electromyography and ultrasound, the data was super clear. The placebo group using that springless sham device, they saw absolutely no significant changes. But the experimental group had a massive physiological victory. The resistance training successfully induced hypertrophy, which means their swallowing muscles literally grew physically thicker and became significantly more electrically active. They were building real, functional muscle mass at 70+ years old. How cool is that? So the crucial point here is that thicker muscles really only matter if they actually stop the choking, right? Well, let's look at the penetration aspiration scale. Basically, a lower score here means a lower choking risk. The experimental group started at a pretty dangerous 5.31, but after 6 weeks, that score plummeted to a much safer 2.41. Meanwhile, the placebo group barely budged. This proves conclusively that the experimental device drastically improved airway protection for these patients. The researchers summed it up perfectly with this conclusion, stating that the findings suggest the novel neck collar exercise device is effective in enhancing suprahyoid muscle activation and in reducing the risk of airway penetration and aspiration in older adults with oral hypofunction. So what does that mean in plain English? It means the vital pulley system in the neck is working again. When these folks swallow, their newly strengthened muscles are successfully yanking their airway up and out of danger, securing their safety with literally every single bite they take. Which brings us to a really powerful question to end our explainer on today. If something as elegantly simple as a little mechanical spring inside a plastic collar can give older adults their safety, their nutrition, and frankly, their dignity back, what else is possible? I mean, what other physical frailties of aging could we solve with accessible, thoughtful innovation in the decades to come? It really challenges us to rethink rehabilitation entirely, not as forcing vulnerable people to adapt to difficult therapies, but instead adapting therapies to perfectly fit the vulnerable. Thanks so much for learning with me today, and as always, keep asking the big questions.